Good afternoon, everybody. Good afternoon. We're glad to have the attendees. Keep coming in. We're glad to have you. Welcome on board, everybody. I would implore us to please make it as lively and as interactive as possible. So we'd like to meet you. We'd like to see you. Please put it in the comment section where you're joining us from. Let us know where you're joining us from and what sector you work in so that we can know that you're right there because you are of priority to us. So please, every participant, let me know if you can hear me. If you can hear me, just drop something in the comment section. If you can see me, drop it in the comment section where you're joining us from and what sector you work in. We're glad to have you. Oh, great. So right about now, we will begin. Once again, I welcome you all, wherever you're watching from. Good morning, wherever you're watching from. Good afternoon, if that applies to you. And please leave it in the comment section where you're joining us from. Let us know the country, let us know the city you're joining us from, and what sector you work in. So I will be taking us through our housekeeping rules. And before I do that, you know this Spanish adage that says that a man who is too busy to look after his health is like a mechanic that is too busy to look after his tools. Right. So if you are too busy to look after your health, which is your body, which is definitely like your tool, you're just like that mechanic who will soon close his shop. So I'll be sharing my screen shortly and taking us through the housekeeping rules. Please bear with us. These rules are just to ensure that we all have a good time today and to ensure that we do not have interruptions whatsoever. Okay, I can't share. It's not like it's disabled. Mm-mm. Awesome. The comments are coming in. The comments are coming in. Thank you very much. Let's know where you're joining us from. Admin, please, I'm still trying to share my screen, but it's not coming up. Could you please look into it?
We are sharing the screen from our end. Can you see that, please?
Yes, I can. Thank you so much. So our dear esteemed audience, please note that this webinar is being recorded. This is just to ensure that we have all that we need to get across to you, to send to you after the webinar so that you can keep in touch, you can keep watching to remind yourself of the very, very life-transforming tips that will be shared today on how you can balance out on both sides. And all participants are automatically muted by the webinar administrators. We also implore you once again to please bear with us so that we don't have any form of distraction or disruption as the case may be. And note that there will be polls in the course of the webinar. Please ensure that you engage. We want to feel you. We want the comment section to be very lively. I can see the comments coming in already. We can see where you're watching from and the sector where you work. And we're so excited to see that. So please keep the energy going. Engage when the polls are up so that this can better help us know that we are all on the same page. Because, like I said, you're important to us. And the Q&A feature is right there for you to send in your questions. If you have any question as the webinar is going on, send in your questions, drop your comments. That's because we have professionals in the house. We have medical professionals, we have financial analysts who are ready to answer your questions. So make use of that Q&A feature. Just click on it and you will be able to put in your questions or your comments as the case may be. And like I already said earlier, this webinar will be sent to everybody at the end of the session. Thank you very much for going through these housekeeping rules with me. At this point, I would be introducing the two sides that we have on the call today. We have Mediplan and FundQuest. Mediplan is a health maintenance organization, and they are committed to providing the public and individuals health care services through a prepaid arrangement. FundQuest, on the other hand, is a financial institution that is committed to giving you tailored services towards your loans, your leases, your investment, and even business advisory. So without further ado, we would have a poll coming up right about now so that we can still further engage you. Thank you, those watching from Abuja, those of you watching from Lagos. Thank you very much. Keep the comments coming in. So we'll be having our poll coming up right about now, and we would want everybody to participate. Right, we have it there on the screen. Confirm if you can see it by just submitting your answer. Which would you choose? 20 million naira now or a lifetime health insurance? Oh my goodness, which would you choose? Remember that this is anonymous, so you just click on whichever one it is that you choose. There's no penalty. We just want to be sure that we are all on the same page, and of course to know which you would rather choose, a 20 million naira now and a lifetime health insurance. Keep the results coming in. Keep the results coming in. Thank you very much. Keep the results coming in. If you have not voted, you have the poll on the group right now. Which would you choose, a 20 million naira now or a lifetime health insurance? Do we have all participants' submission yet?
Maybe just in 10 seconds time. So the results will be up. So you have 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Yeah, results will be up now.
Thank you. Amazing. Okay, please don't ask me. Don't ask me which I chose or which I would choose if I'm asked over and over again. Please don't ask me. So we can see 20 million naira now with a total of 66% of the participants, and 34% goes to a lifetime health insurance. Well, we'll see. As we go through the course of the webinar, we'll see which is meant to be. Right. Thank you very much for submitting. Before I introduce the first speaker, I would like to say that I had my first degree in health education, and now I currently work in a financial institution. So I'm your first intersection, right? That being said, as we move along, you'll see how these two have come hand in hand and how it is imperative that no side of the equation is left behind. I remember then as an undergraduate, we were taught that, according to WHO, that health is not merely the absence of diseases or sicknesses, that it is a complete state of your physical, your mental, your emotional, your financial, your spiritual well-being. So it's a complete state of all of that, of an individual. It's only when you're healthy on all fronts that you can say that you're truly healthy. You can't just have the money or your physical state is in disarray and you say you are healthy. And for someone like me, when I take a look at the word health and I take a look at the word wealth, if you look at the spellings of the two, the difference we have is the H and the W. So I am of the opinion that the W says your wealth is as a result of what you do. The W, the what you do. And the H is how you do it. The age is how you do it. Your wealth comes as a result of what you do, and your health comes as a result of how you do it. How do I mean? For example, my job requires that I sit behind my desk every day and do all that I need to do, right? So that is the what. That is what can bring about my wealth, right? That is what I do because I'm being paid my salary. I can invest, I can save, I can create wealth for myself based on what I do, how I do it. When I come to the office in the morning, do I have breakfast? Or I just get into the work and I'm so busy without breakfast. And before I know what is going on, my stomach is rumbling. When I come to the office, do I ensure that I drink water at least every hour? So, as we look at the intersection of health and wealth, balancing financial goals and healthcare needs, I'll be calling on our very first speaker for today, the person of Mrs. Joan Omotola Adekombi. Joan Omotola Adekombi is an experienced medical practitioner, having qualified as a registered nurse and registered midwife from the Lagos University Teaching Hospital in 2000 and 2003, respectively. Prior to joining Mediplan Healthcare Ltd in April 2022, she has worked in various health maintenance organizations as HMO operations manager, unit head, unit lead, case management executive, quality assurance executive, among others. She has attended further trainings in the fields of medical practice, and she has over 20 years post-qualification experience in the nursing profession and about 10 years experience in the HMO industry. She's currently a senior manager in Mediplan Healthcare Ltd and the head of the contact center. Ladies and gentlemen, please welcome with me. You would see that we have a very rich panelist here. Welcome with me, Mrs. Joan Omotola Adekombi. Over to you, Joan.
Thank you, Grace. It's my pleasure to be here. This afternoon, we'll be looking at a topic, and this topic is work-life balance and effects on health and wealth decisions. Okay, I hope you can see me. I hope you can see my slide now being shared. Grace, please, can you see my slide?
I can see your screen.
My screen.
Yes. Okay. Your slides are not up yet, but your screen is up.
Okay. Sorry about that.
That's okay. I can see that your slides is just right down here.
Okay. Yes. Okay, thank you so much. Okay, so this afternoon we'll be looking at work-life balance and how it affects health and wealth decision. Looking at how you as an individual, you're able to maintain your work and your personal life and being able to have a balance between both, having an equilibrium, and you still standing strong and healthy. That's what we'll be looking at this afternoon, because this is actually very important and it's pertinent to our existence. In this training, we'll be looking at introduction, we'll be looking at the importance of work-life balance, the causes of poor work-life balance, impact of poor work-life balance, and the strategies to actually achieve a work-life balance. If you look at that picture, you will see the circle there. Look at work, look at life, and also look at health. You can see the intersection of these three. That colored portion is a balance we are looking at. That balance is important for you to actually live a fulfilled and healthy life. By definition, work-life balance refers to the equilibrium between professional responsibilities and personal life. where an individual can actually allocate time and energy effectively to meet the demands of both aspects. A healthy work-life balance plays a crucial role in overall well-being with significant implications for your financial health. Now, we cannot talk about work-life balance without talking about a healthy workplace. For a healthy workplace, it's a place where everyone works together to achieve an agreed vision for the health and well-being of workers and the surrounding community. Because the workplace is healthy for your staff, for those working at the organization to be okay, to be able to balance their life. And the organization has a role to play to ensure that the workforce is healthy. Now, if you look at the factors in successfully managing a work-life balance, it's actually the ability to reduce and control stress. That is what makes you to be able to have a work-life balance. Okay, you may want to ask, what if I not balance my work life? Is there any reason for that? What are even the reasons? Why should I? First on the list is an improved mental and physical health. It's important because with a work-life balance, you're going to have fewer health issues. You're going to have fewer health issues. You're not going to be in and out of the hospitals. You're going to have a sound health. And of course, when you have a sound health, you have a prolonged life expectancy. In Nigeria, as at 2023, the life expectancy has been placed at 55.75. For women, they have about 0.8 to 0.9 higher than male. But if you are able to balance your work life, you're going to have a higher prolonged life expectancy. So it's important. It's very key. Aside this, you have an enhanced productivity and career growth because you are going to do better at work. You have improved concentration at work. You can concentrate at your work. You have a house because you have actually concentrated. You want to have a higher output. When your output is high, what happens? You get promoted. When you're promoted, you are happy. You retain your work. You're not going to lose job. You may need to ask from people, especially maybe men that are out of job. Ask how they cope. It is not an easy one. Now, when you are able to have a work-life balance, you have an enhanced relationship. There is little or no conflict in the family between husband and wife. Just a little inability to balance your work life can scatter a home. I've had a friend before that forgot the children at the crèche. She was grossly involved in her job and she forgot she needed to pick the children in the crèche. That alone can scatter the home. But when the work life is balanced, there is conflict are reduced and avoided. Personal and work relationship are strengthened. And you can make better decisions. Aside all of this, look at reduction in your financial crisis. When you're able to balance your work life, you have lower total medical costs because you are not in and out of the hospital spending money on health issues. You are not even because you are able to balance your work life. You have your job. You are able to secure your job, so you have money to at least have a stable life. So it's actually important to have a work-life balance. You cannot just do away with it. You want to ask, what are the major stressors? What are those things that are actually bringing about those stresses you have? You talk about work, look at the picture there. Work, that is the individual in the middle. Work is there. The health is stressing this person up. Families is stressing him up. The needs of the family is stressing him up. Finances is stressing him up. Are we going to talk about the economic situation in Nigeria? Look at the fuel. Look at all that is happening right now with our economy. And other things, different issues. All of these factors come together to become a stressor to this individual. You can see him there, greatly stressful. These are those major stressors of life. Look at dealing with stress. This is stress there. This stress happened from some stressors. Now look at stress is not something that shouldn't happen. We have the good stress and the bad stress. The good stress are actually what challenges you to even do your work and try to meet some responsibilities. But the bad ones will break down your health. Now the stressor come to this individual, become stress this individual up. Look at the arrow there. This person feels very terrible from the stressor, that has brought about some stress into his life. And then he feels so awful and terrible. Now, there are two ways to it. It's either you use the positive coping strategies, you cope with it. If you are able to do that, you feel better for a very long time. The positive coping strategies for a very short time, and then the stress remains, then it goes back. Those issues, your inability to overcome the stress become another stress to you, and then the cycle continues. You can imagine what happened to this individual. Looking at the impact of poor work-life balance at that individual who was not able to manage the stress very well, using possibly the negative strategies in managing the stress. What happened to this individual are this. There are so many health issues that happen to this individual. Every system of the body is being affected. The brain, cardiovascular, the joints, immune system, the skin, all of them are being affected. When you talk about the cardiovascular, you're talking about hypertension, hypertensive heart disease, stroke, and all of this. This happened because this person has not been able to manage this stress appropriately and adequately. This person can have hypertension. I've had somebody before who was duped. Because he was duped, the next thing he came down with hypertension. Not because this person is highly stressed up. You want to deliver on that assignment, forgot to eat, skip meal. The next thing you see this individual coming down with ulcer and even decreased nutrient absorption. Because you are not able to cope with your stress, apparently the immune system is reduced. When the immune system is reduced, this individual is able to come down with infection, with disease easily. The bones are affected. There can be lumbar spondylosis, there can be scoliosis of the spine, even osteoporosis. The bone become very brittle. All because of stress. There can be late onset of diabetes mellitus, mental health disorder, look at it, anxiety, depression, even burnout. All because we're not able to cope with your stress and being able to manage your work life together. Kidney can be damaged, liver can be damaged, there can be reduced life expectancy. All of these are terrible impacts of poor work-life balance. You can imagine, even to the family and the society, there is lower life satisfaction, there is high rate of family strife. All of this strife can lead to violence, and even from violence, there can be divorce. Look at that picture there. Look at that man beating the woman up there. Look at the family there. The family is already divided into two. All because this individual, all of these are impacts of poor work-life balance. There are some coping lifestyle habits worsen health status. Because you want to cope with the stress, you go into tobacco use. Tobacco use is only destroy the lung. It's going to destroy the lung and even cause lung cancer. And let me tell you, you can see, and I mentioned that when you have poor coping mechanism, you only be okay for a while, just a short while. Just a short while, because when you take the tobacco, you feel high. But please, don't forget, when the effect of the tobacco reduces, you will come back to the stressor. As in, you are right there. It just, you want to meet up, you refuse, you stay glued to your seat all through, trying to say you want to meet up with a responsibility. Physical inactivity will lead you to obesity. Look at the picture there. Obesity can lead to hypertension, hypertension can lead to stroke, and stroke can lead to death. Now, unhealthy diet and poor eating habits, because you want to cope with stress, you now start eating junk. Oh, no, I don't have time to cook. Take Coke and gala. You take Coke and pizza. You take Coke and biscuits. As in, picking junks that are not healthy for you. All of these things will eventually increase your calorie, and then you can say it's eating. Some people go into taking too much of coffee. Yes, coffee contains caffeine. It makes you alert to be able to attend to, your responsibility and all that. But there's a limit to it. You are not expected to take more than 400 milligrams per day. If you must take it, and that is equivalent to 4 cups in a day. But if you can even do less, it's better. Because too much of coffee can eventually lead you to chronic insomnia, chronic stress, and even depression. All of this eventually will see cause hypertension, and then you can see where that's leading you to. Alcoholic intake. Some people go into alcohol because they want to feel high. Your eyes will be clear eventually, and you will still see that the stress right before you. Alcohol will only damage your liver. It will damage it. And at the end of the day, what have you got into yourself? You can even get cirrhosis from alcohol. Poor sleep. You can't sleep well. When you're not sleeping well, because you must meet up to that task, it must be delivered by 6 a.m. You refuse to sleep, you shorten your sleep pattern. At the end of the day, what happens? You're not going to have the mental alertness. You're not going to be able to make good decisions. At the end of the day, you run into trouble, even with hypertension and other health issues. Sedentary lifestyle. You just stay because you don't move around, because you're trying to take care of managing stress, poor stress management. It is not good for you, because usually it leads you to obesity. All of these are poor coping mechanisms. It is not good for you. At this point, we will be looking at the strategies shortly of maintaining a work-life balance. But before then, we need to take a poll.
Thank you so far, Joan. I'm sure our participants are submitting their answers already. Yes, keep them coming. As a career professional, do you stand up from your seat every 1 hour? Do you exercise for at least 20 minutes a day, minimum 3 times a week? Keep the answers coming. Keep the answers coming. Oh my God. The percentage is increasing. Awesome. Please keep the answers coming. Okay, I believe we have all votes already. Joan, over to you.
Yeah, thank you. Okay, I'm looking at the results from the phone now. The first one is, as a career professional, do you stand up from your seat every 1 hour? We're seeing about 7% saying yes, while the 53% says no. You see, when you sit for too long, it's unhealthy for you, because it can affect your bone, it can affect your back. You can have a lumbar spondylosis. You can have, because you're sitting too long, that is inactivity, and that is sedentary, and that can increase you having obesity, and it also has a tendency to increase heart issues. So it's actually good for us. A take-home from here is at least within 30 minutes. After a 30 minutes, you should stand up for at least 1 to 2 minutes. It's very important for you to stay healthy. It's actually good for you. It's good for you. So we're going to be looking shortly at the strategies to maintain a healthy work-life balance. The strategies are actually divided into,
Sorry to interrupt you.
organizational.
You might want to stop sharing and reshare so that your screen will be able to move.
Okay. Sorry about that.
Great.
Sorry about that. Shortly, we'll be looking at those strategies so we can have a work-life balance. Okay. So approaches to improve our work-life balance, we've talked about the stressors coming in and causing stress. Now, you can modify the stressor. If there's nothing you can do, at least you can modify that stressor. Or you can also change your reaction to the stressor. When you cannot change a situation, change your reaction to the stressor. You can also change your perception or belief about the stressor, and also practice stress inoculation behavior. You are expecting something to happen that may stress you, or you already prepare yourself towards it. That is the practice stress inoculation behaviors. So we're moving to look at those things, those tips that will help us achieve this balance. Now, talk about organization. As an organization, we expect that you should take care of your staff. There should be good working condition for them. You should consider them in your decisions. At least they should have work too, because when there's no work to, that individual can get frustrated and will not be able to perform well. And you can also consider some flexibility in their job, because even the financial responsibility of coming to work, even considering the economic situation is so terrible. So you may want to consider that just to help them. You also want to look at, okay, motivation for them so that they're happy to do their job, and so many other things at the organizational level. But coming to an individual, as an individual, you must set realistic goals, short time, long term, for work, for personal, and for finances. And like I said, realistic goals. You are aware that your salary can only allow you get a room and a parlor apartment, but you did not go for that. You chose to go for a duplex that in 6 months you cannot maintain the rent. Then you have opened yourself up for stress. So realistic goal is very important. Don't forget to prepare your to-do list daily, weekly, monthly, and yearly. And start it from yearly and break it down to weekly, to monthly, to weekly, and to daily. You must have a to-do list. And whatever is actually personal, because what is important to you is different from what is important to me. But you must be able to have this to-do list and work with it. Take it out when you are done with them, so that you will be able to achieve important things. You'll be able to at least achieve your objective that you have set out to do. Because when you are not able to achieve your goal, you get frustrated. Use the time management matrix. You have the first one is saying important and urgent. That place you shouldn't have more than 5% of your time using that very quadrant, because that is where there is stress. Your heart is always up there. Oh, it's urgent, it's important, I must deliver. That individual may die of hypertension. But the second one is saying it's important, but it is not urgent. That is where you should have more of your time, because you're going to prepare yourself. That's where you can paint, you can plan, you can prepare different things. Is it your head check? Is it the work you need to do? Is it a report you need to submit? You have prepared it. You have time to prepare yourself. Nothing comes to you as an emergency. Then the third one, it's, yes, it is urgent, but it is not important. All of these ones, oh, this thing, yes, it is urgent, but if you don't do it, heaven will not fall on earth. Your time shouldn't be much there too. Then the last quadrant, the fourth one, is just a time waster. Just you suffering the net aimlessly, or you are just browsing your phone or picking your phone or taking things that does not really bring so much to you. Unfortunately, so many people actually do well in this quadrant, which is not good. So your time masters will help you. Know your limit. Learn to say no. You are going to say it politely. It is not insubordination. You are not able to do, oh, sir, your boss said, deliver this in the next 1 hour. You know that you cannot deliver this in the next 1 hour. It will take you 3 hours to deliver it. Why don't you please politely explain that you are not able to do it? You must learn to delegate. Observe your break. Go for your paid off leave is important. Boundaries so that you can unplug. Talking about medically, you must prioritize your health. That's right. Take a lot of fruit and vegetables because to boost your immunity. You must exercise daily. You must rest at least 6 to 8 hours in a day. It's important. Copious water is important. It helps you.
Mrs. Adekombi, Joan, you're muted.
Yes, I think Mrs. Adekombi is having network issues. Grace, we can take it up from here because of time. Let's just please take it up from here. Thank you so much. Thank you.
All right, thank you so much. It's been a very beautiful session so far. I hope our participants, I hope you had or you still have your pen and your jotters with you, taking down very important notes, just as I've been doing here. Thank you so much. He's been able to walk us through having that equilibrium between professional responsibilities and a personal life, meaning that achieving a work-life balance is not a fallacy. It's not something that is not achievable. She's been able to walk us through the importance of having it. She's been able to help us see the stressors that we'll face from time to time. And how many of you know before now that we have good stress and we have bad stress? Well, I caught that. So as much as we've been listening so far, I believe that you have picked 1 or 2 things that you're willing to apply to your lifestyle going forward so that you are able to achieve that work-life balance, whether as an individual or as an organization, even for your staff. So at this point, very quickly, if you have any question, please drop them in the Q&A section. Just click on that Q&A icon right there and drop your questions. Like I said earlier, we have financial analysts in the house. We have medical professionals right here to answer any of the questions you might have as it relates to balancing your health and your wealth, achieving that equilibrium. So very quickly, I'm going to be introducing our second speaker in person of Mr. Olubunmi Elesho. Mr. Bumi Elesho is a director at Mediplan Holdings, Royal Exchange Prudential Life Assurance PLC, Mediplan Healthcare Ltd, Prepaid Medicare, amongst others. He also sits on the board of directors of Alpha Partners Limited. He has led the company into various lucrative long-term investment deals and activities in oil and gas, telecommunications, banking, information technology, real estate, and chemical manufacturing, to mention a few. He's a chartered accountant with rich experience, with his profile spanning over 25 years of professional application. He won national prizes at all 3 stages of the ICANN examinations in a record of 18 months period. Welcome, Mr. Bumi Elesho. Over to you, sir.
Thank you very much, Grace. And good afternoon and good morning, everybody, depending on where you are in the world. I'm going to be sharing very quickly. I think I have a 10 minutes limit, so I'll be moving very quickly in terms of what I'm going to be sharing this morning or afternoon, as the case may be. I hope my screen is clear to everyone. So I'll be talking about balancing our financial goals with healthcare needs. My colleague John has spent extensive time to do some to explain further on the healthcare perspective. So I'm going to focus a little bit more on having realistic financial goals and getting to meet them. My presentations will start with an introduction. I'll talk briefly on the need to manage our time. John has also spent some time on that. Developing long-term financial goals, managing lifestyle costs, having a personal balance sheet that you watch regularly. Most of us don't do that. Then the principle of compound interest, which is the biggest secret to wealth creation, and the impact of time on our ability to create wealth. In today's fast-paced environment, obviously many people are stressed out. The challenge of pursuing life goals, especially financial, with dealing with our other responsibilities and managing our health is often a challenge. Like John, my colleague, said, we have to learn to prioritize and say no to a number of demands for our time, either from family, from friends, even from our workplace, and from social commitments. We must learn to say no from time to time. And let me now dive down to focus on what is crucial. Time is the biggest resource that God has given every human being. And how we manage this time, how we balance the demands of this time is the biggest issue. How do we allocate and use our time? We all have 24 hours every day, and we have to daily allocate these 24 hours into various activities and also plan for adequate rest for our bodies. While doing the above, we have to ensure that the body has enough time to rest, to recover, and to manage our stress levels. I think John has, like I said earlier, has spent some adequate time on stress management. In terms of developing financial goals, we all have financial needs, but very few of us have any strategic plan to achieving these goals. And how well we handle this issue determines how stressful or how much stress our financial needs puts on us. When we don't plan and execute well, the need to pay our bills becomes a significant stress point. This is avoidable. Let me also say by this that in spite of the short life expectancy in Nigeria, I want to believe that many of us will grow old enough to retire. Now, we all start life working for money, and if we're fortunate enough to retire, we end up with money working for us, either through our pensions or if we're smart enough to have developed income-generating assets, or we can have both. Now, in terms of long-term financial goals, wealth is created on three primary factors. Regardless of what someone is doing for business, for a living, whether you're an entrepreneur, whether you are you're a career person, whether you're a sports person, whatever it is, three main factors apply to everybody. Number one is time. The earlier we start, the better we are at creating wealth. Number two is your return on capital. The higher the return, the more capital we can create. Number three, your savings and investments. No matter how much you make, if you don't save anything, you don't create wealth. A man that earns 5 million a year and saves 1 million every year will end up becoming richer than the man who earns 50 million and spends 51. Because the first one is creating wealth, is adding 1 million every year to his or her investment portfolio, while the other one is not borrowing more money every year. Now, let me give you a very simple example. If a young employee who starts earning ₦1 million a year today saves 100,000 every year and invests this 100,000 in a fixed income yielding instrument, earning 10% per annum, this young man over a 40-year period will build a 48 million naira nest egg, investing only 100,000 every year, which means that this person will have invested only 4 million over these 40 years, but will have created a 48 million naira portfolio and using just 100,000 every year, assuming that the person doesn't get a salary increase, which is unlikely. The person is likely to get a salary increase over a 40-year period. Now let's go back to lifestyle costs, because Stress in finances is a function of two basic issues. Number one, unrealistic financial goals, and number two, unsustainable lifestyle costs. I think most of us have problems on these two areas, even though I think the second one is a bigger issue. Many of us live in homes, especially in Lagos, we can't afford. Rent is expensive in Lagos. We buy home equipment and drive cars we can't afford. One of the things I've noticed recently is many of us send our children to schools we can't afford. And this is a major avoidable stress point that many of us have developed, and it takes a toll on our long-term health and finances. And let me also say this: wealth is created by investments. Investments are products of savings or windfalls. A windfall could be an inheritance or a one-off event. Maybe something happened and you are fortunate to be somewhere and you made some extra money legitimately. Savings are a simple equation. Windfalls you can't plan for because they are, as they are, windfalls. There is not something, apart from inheritance, where you know that, okay, there's somebody that is about to pass away. But one-off events you can't plan for because they're not within your control. But savings you can plan for. And savings are a simple equation. Your income minus expenses is equal to your savings, and it's your savings that becomes your investment. I recommend for everyone to learn to live within 90% of your income so that you have 10% available for savings and investments. As much as it's painful, one of the biggest issues about wealth creation is also the principle of delayed gratification. Delayed gratification simply means you can afford to do something today, but you decide to delay it till tomorrow so that you can create a better tomorrow by avoiding that investment at that particular point in time. Now, if you have to do all of this, you must be disciplined in terms of your budgeting. What do I mean? For a balanced budget, we need to look consistently at our three biggest costs: rent, home housing, transportation, home car, school fees for our children. My suggestion to everyone is that make sure these three top budget items are not more than 75% of your income. If you can reduce it to below 75%, wonderful. Then we also have other costs. Many of us have all kinds of responsibilities to parents, siblings, etc. In our culture where social network is very powerful, we also have to manage all of these bills so that you can have at least 10% for savings. I was going through about 2 or 3 days ago a BBC documentary that was saying that UK residents today spend 28% of their incomes on rent, and it's not sustainable. In Nigeria, many people spend more than that, especially in a town like Lagos. So the above guide are just limits. Savings on a line item, for example, if you're able to reduce your rent as a portion of your income, then you have additional funds available, maybe to pay for extra school fees, etc. But the most important thing is you want to achieve 10% savings on your total income. Now, what do I mean by personal balance sheet? Many of us don't have one. In a personal balance sheet, you need to look at your assets. Most of us, the biggest asset we have, if you own a house, is the house you are living in. But that house is not generating any income for you. Some of us that don't own houses, the biggest asset we own might be a car or the equipment in your house, television, etc. These are things that don't generate any income at all. So you need to look at your balance sheet. The older you are, you get, the greater the percentage of your balance sheet that must be in income generating assets. When you are young, you can afford not to have a good balance sheet. But as you grow older, I'm going to be 57 in a couple of weeks. And I'm at a point now where at least 80% of my balance sheet must be income generating. The older you get, the more your balance sheet must have income generating assets. Many of us invest less than 20% of our balance sheet on income generating assets. What am I talking about? Fixed income instruments, quoted shares, rent generating real estate. This poor balance sheet management leads to poverty when we grow older. And many people are at a point where some of my colleagues are retiring. And I noticed some people after 3, 4, 5 years after retiring, the last car they bought was 10 years ago because they don't have a balance sheet that can carry some of the costs that they used to. So it's important that during our most productive years, we plan properly to build a right balance sheet. As I begin to round up, the single most important issue in wealth creation is the principle of compound interest. As simple as it sounds, it's so powerful. Like I mentioned earlier on, someone who saves 100,000 every year and invests in 10% yielding instrument generates 48 million in 40 years. If you do the other arithmetic and say, let's say someone has a windfall of 1 million naira today and invest that 1 million into a fixed income instrument yielding 10% annually, that person builds a 45 million naira portfolio in 40 years. Now, if that investment yields 15%, this is where compound interest becomes very powerful. If you move from 10% to 15%, your yield moves from 45 million to 267 million in 40 years. If its yield is 12%, your portfolio is 93 million in 40 years. So you see the impact of yield. Now, this above all these illustrations assume you are reinvesting all your investment income every year, so that way you can continue to build. Now, let me also give a caveat. It might be a challenge to have fixed income yielding assets that generate 15% over a 40-year period, but 12% is feasible. I believe right now that government bonds are above 12%, and that's the lowest risk in an environment like Nigeria. If we move on to the impact of time, I've used a 40-year horizon. If you use a 20-year horizon, your 1 million naira that generated 45 million in 40 years generates only 6.7 million in 20 years. Your 1 million that generated 267 million in 40 years at 15% is only 16 million in 20 years. So you see the impact of starting early. Time has a powerful impact on compounding. Your 93 million naira over 40 years at 12% is only 9.6 million in 20 years. So to generate this 12% income over 40 years, to generate above 12% over 40 years requires some entrepreneurial and discipline skills. Let me end with this very interesting statistic. Warren Buffett, the world-renowned investor, has generated 19.8% compound annual return over the last 58 years, with his investors who invested $10,000 in 1965 being worth $378.8 million today. I recently read about an investor who invested about, I think it was $300,000 or $400,000 from the business he was running as surplus cash, who today, the investment he has with Warren Buffett is 4 times the value of the entire business he's running. Why? 19.8% compound annual return over a 58-year period is unbelievable. Thank you, everybody. Any questions?
Thank you very much, sir, so much. I mean, this is such an eye-opening session. Thank you so much, sir. In very few minutes, Mr. Elisha has been able to walk us through the long-term financial goals that we must have as individuals and the fact that wealth is created by investment. Oh my goodness, I love that part that says that we can have a personal balance sheet. So as an individual, I can have a personal balance sheet, knowing what to put into my investment and what should go into my spending, such as living costs and the likes of that. Thank you so much. We already have a lot of questions in our Q&A session, and because of time, we will just be taking a few of them. But before I take the questions, let me tell you what you still stand to benefit from attending this webinar. Remember, I told you at the beginning. John, could you please put up the screen for me, please? Thank you. Remember, I told you at the beginning of the session that apart from taking away from here life-changing, transforming messages that you can apply in your daily life. I mean, in a few minutes, we've just seen the balance with John helping us see the balance between work and your personal life, and then Mr. Elisha helping us see the way you can have a balanced cost sheet. I mean, that's already on both sides. So it's a win-win for you. You're achieving stable health, and you are living even ahead for posterity, right? You have enough in investment. You're living fine. You're well, and all other benefits will just follow. John, please take me to the last slide very quickly. I said at the beginning that we are a financial institution and we are committed to empowering individuals and organizations to achieve financial wellness and make informed decisions. Apart from us offering loans, investment to the public, business advisory, we also have our lease portfolio, and you can benefit, especially in a time or at a time like this. In Nigeria right now, we all know the cost of fuel per pump. The price is is over the roof. If you used to fill your car before now with 15,000 naira, you're probably spending way more than 30,000 naira right now. And on the other hand, too, we are anticipating that there will be an increase in the prepaid tariff very soon, right? So because of that, we have a tailored product that we launched, and we would like you to take advantage of that. And that is our lease product, the solar. John, can I have my screen come up so that our participants can see the numbers that he can call or the mail that he can reach out to? Thank you very much. Thank you. So we're saying that take advantage of our solar package right now for you. We can fund you to get solar into your house. So no fear, no fear. You don't have anything to worry about. We give you unlimited power and limitless possibilities. Get across to us by attending this webinar alone. You have so much to gain. Thank you very much. We move to the questions right now. I believe that, okay, I have a question here. I believe that our panelists are ready. So I really appreciate this topic. Thank you very much, Purdue. I want to ask, how do you cope with a toxic work environment and toxic boss? How do you cope with a toxic work environment and toxic boss? Because I believe that there is no way you can be able to even create your wealth if you're not healthy in the first place in a toxic environment. John, over to you, please. In very brief seconds, few seconds, please answer this question.
Okay, coping with a toxic work environment and a toxic boss. First, you must be able to give feedback to your boss, because your boss might not even know. You know, you think he's toxic, but he might not really know. You should be able to give a feedback, you know, politely to your boss. And also, you must look at the situation. There are times you might also need to change yourself to be able to understand your boss, because you're not going to sack your boss. So you might also need to change your own self to be able to meet up with the request or requirement from your boss, so that you will still be able to have a very good relationship. And for toxic environment to work environment too, you should also have the ability to be able to give feedback even to the HR, so they will know exactly what exactly you feel within you. And it may even get to a point, if like you cannot really cope again, it might not be out of place to say, sorry, you may want to have maybe a change. Thank you.
Thank you so much. I move to the next question now. We have quite a number, so I'm just going to skip. In the face of current economic situation, how can one manage cost of living and still achieve the projected financial goals? In the face of current economic situation, how can one manage cost of living and still achieve the projected financial goals? Mr. Alessio, please.
Thank you very much. It's an ongoing challenge. I think the biggest issue is basically the principle of deferred gratification. The challenge with Nigeria is we have a culture that puts us under pressure. You want to drive the best cars. You want to wear the best clothes. You want to live in the best environment. That's the challenge. And that peer pressure is what puts us under pressure to want to do certain things that we can't afford. So the first thing is you must be able to find a way to divert yourself or divest yourself from that peer pressure. For years, I was also under the same pressure. As salary increases, you increase your bills. You want to change house from a 2-bedroom flat to 3-bedroom flat. etc. That is something that I found that we continue to do, and before we realize it, we are close to retirement. And once you're getting close to retirement, you suddenly discover you don't have any assets. So each person needs to significantly sit back. And then Nigeria is at a point now where the issue of husband working and wife not working does not arise. Both parties have to work, and both parties have to develop a strategy jointly to invest in such a way that you build capital over time. But I know it's a challenge, but the most important thing is you need to look at all your avoidable and discretionary costs and decide to scale down significantly so that you can build into your future. Of course, if you can find a way of earning more money without it impacting your job, wonderful. But I've discovered that it's easier to manage your costs than it is to increase your revenue. I hope I've answered that question, Grace.
Yes, sir, you have. And in fact, you answered a couple related ones as well. Thank you so much, sir.
You're welcome.
I would take another very quickly. Without challenging the importance of saving as adduced by the second speaker, my question is, what would 45 million get in the next 40 years? Of course, 45 million in the next 2063 will certainly not be the same value as it is today. Do you still think it is worth it? Do you still think it is still worth it to save for that long?
Is that also to me, I believe?
Yes, sir. That's also to you.
Okay, the first question you need to ask yourself is that, would you rather have 45 million than have nothing? You see, because if you're not saving, you end up with nothing. That's the bottom line. So regardless of what it is worth, the first issue is it's better to have something than have nothing. That's the first issue, because the bottom line is, whether we like it or not, the future will soon become the present. And if we're spending all we're making today, we're going to end up with a future with nothing. So that's the issue. The environment we're in has what you call a lot of headwinds. So it's like you are running against the wind. So the wind, as you're trying to make progress, the pressures are pushing you back. But will that make you stop running? Because if you're not moving, then you're actually moving backwards. So the most important thing we need to recognize is not the value of 45 million in 40 years, but the difference between having 45 million and having nothing. Because if you're spending all you are making, you will end up with nothing. That's the bottom line. It's not a prophecy, it's just a statement of fact. I hope that's clear enough.
Very clear, sir. Very clear, sir. Thank you so much. I think I would have to take the last question now. We're so sorry for some of the questions that we're unable to take. We can also realize that there are some questions being dropped in the comment section. We see them all, and we believe that for some of the questions that have been answered already, some of your questions have been addressed. The answers have been addressed. So the last question I would ask will go to Mrs. Adekombi, and it says, does skipping breakfast affect the ability to think and be active at work?
Okay, thank you. Breakfast is actually the most important meal in the day. So it's actually very important to take your breakfast. It's the most important meal you have to take for you to be able to perform, for your brain to be able to perform adequately. So skipping breakfast is not healthy at all. And you are going to be doing yourself a lot of harm. You're not going to be able to really perform well, even at your job, when you skip breakfast. So please do take your breakfast. And of course, your stomach is important. You don't want to get an ulcer, so it's important to take your breakfast. Please, it's the most important food in the day. Thank
you so much for that apt answer. At this point, we've taken as many questions as we could because of our time, because we do not want to keep you waiting for too long. If you look through the comment section, you will see that we already gave you some tips on how you can get across to us. Take all that you've listened to from here and let them have impact in your lives as individuals and as an organization. At this point, I call on the Executive Director of FundQuest Financial Services Limited to give us a vote of thanks. Mr. Bisioni.
All right. Okay, thank you so very much to everyone who joined this event today. It's been an awesome session. Big thanks to the speakers, John and Ebumi, for an excellent discourse. We want to thank you for making us fully understand the nexus between health and wealth. Particularly, I have loads of questions which I've put out there. I guess the panelists will do justice to that, even post now, to ensure that we're able to get feedback. And to all other people, those attendees who have questions and they've not been answered, I'm sure our panelists will answer that and we'll make sure we get back to you. So on behalf of the board of FundQuest Financial Services, the management and all staff, we want to say a big thank you to you. This is FundQuest, and we love to do business with you. Thank you so much for your time. Have a blessed day.
Thank you very much, everybody. Thank you once again. Give your dreams the breath of life with FundQuest. We look forward to hearing from you. Bye.